Hi, Dr. Hart. I just saw Miss Hansen. She's a 40-year-old Caucasian female with no significant past medical history except for type 1 diabetes, which was diagnosed in 1990 and in the past has been fairly well controlled. But in the last year, she's been traveling a lot more for work and she's had a lot more stress in her life. The medications that she's currently taking include Lantus 70 units daily and short-acting Humalog. Hello again. This is Dr. Hart.
Good morning.
Dr. Hart, this is Miss Hansen and her sister Natalie.
Nice to meet you as well, Natalie. Thank you for coming in. Thank you for speaking with Allie and sharing what's been going on with her. It sounds like you had a good interaction with her, so I'm glad to hear that. Thank you for that feedback. Now, Allie tells me you've had some concerns. You've been traveling a lot with your work and had a lot of job-related stress. With that, your sugars have been difficult to control, and you've had a number of concerning highs and lows. You haven't been feeling well and haven't been sleeping too well either. I'm really sorry to hear that. But, you know, and it sounds like you've also had a difficult time getting a plan of action that really worked for you. So I'd be more than happy to help you with that. So what I'd like to recommend is getting more healthcare team members involved in your care. First of all, I think that it would be very beneficial to refer you to an endocrinologist, a physician or a physician assistant team who specialize in blood sugars and hormones, and they can talk with you about some options for controlling your blood sugar, including an insulin pump. I'd also like you to see a diabetic nurse educator who can talk to you about food choices while you're traveling. I know that there aren't all the same nutritional options available, but there are some things that can help you control your sugars and feel better. And Allie tells me that you've been having some concerns with balance, nothing specific on physical exam, but I'm really worried about the balance and would like you to work with a physical therapist to improve your strength and conditioning so that we can reduce the risk of falls. And then lastly, with all of the stress, as you know, that can affect the rest of your health and some of the choices and your energy level. So I really would recommend you see a counselor and deal with some of the stress so that you can be in overall better health.
Okay.
What do you think about some of those recommendations?
Thank you so much. You know, I appreciate your time. You know, I really want to face this head on. It's affecting my work and personal life, so any resources you can throw my way, I would really appreciate.
Well, great. I'm very happy to help you. I'll put in those referrals, and what I'll do is I'll send over your medical records to all of the consultants so they have that for the record, and along with your most recent lab results. And I'll also send a copy for you for your own medical record.
Okay, thank you.
Hi, Ms. Hansen. It's a pleasure to meet you. I have a note from Dr. Hart that expresses your concerns about your balance lately, and she also noted in her physical exam findings that she noted balance problems. So I'm really glad to have that information. It's helpful in my assessment, and that'll help you and I to work together on improving your symptoms. Hi, Dr. Hart. This is Pam at the physical therapy office. I just saw your patient, Ms. Hansen, today, and we worked through our first balance and strengthening session. I think she's going to do really well. I did notice that she's wearing shoes that weren't very supportive for her feet, and she said that she couldn't afford a better pair that I had recommended for her. I happen to know of a program that will cover the cost of appropriate shoes through Medicare with a prescription from you. I'll fax that information over along with my note.
Well, thank you very much for that information. No, I really appreciate it. I didn't know about that program, and I think it's going to make a difference for Ms. Hansen. I really appreciate all you're doing for her, and I just wanted to let you know I have a lot of positive feedback from patients that I send your way, so thank you very much for that. Okay, take care. Bye.
Okay, Ms. Hansen, thanks again for coming in this afternoon. I went over your records, and meeting with you, I think you're an ideal candidate for an insulin pump. So I'm going to go out and I'm going to run this by the endocrinologist that I work with, and then I'll come in and set it up for you. I also encourage you to meet with the diabetic nurse educator. I think that's really important, and it'll give you a lot of information. Then what I'll do is send a recommendation report to your primary care doctor. That sound okay?
Yes.
Okay,
Thank
great.
Good morning, Ms. Hansen. It's
Hi.
so nice to see you again. How are you feeling today?
Better. The insulin pump's been working great, and met with the counselor. She was fantastic, and the physical therapist that's been working for balance. It's been really nice. I've never had a team of people working to help me out, and I really appreciate it. Thank you so much.
Oh, that's wonderful. Good to hear. You're welcome.
Effective communication starts with verbalization of willingness to work together toward a common solution. This process is facilitated by consistently communicating the importance of teamwork in patient-centered and community-focused care. It is vital that various team members communicate with one another in a form that is respectful, understandable, and avoids discipline-specific terminology or jargon whenever possible. Additional skills include the ability to express one's knowledge and opinions to team members involved in patient care with confidence, clarity, and respect, working to ensure common understanding of information interpretation, treatment, and care decisions. Showing receptiveness and respect for feedback from other team members creates an environment that is safe and empowering for all involved. It is important to listen actively and encourage ideas and opinions of other team members. When this is done well, and ideally incorporated into an organization's culture, team members feel encouraged to share information that leads to a better understanding of patient needs regarding care and safety. Resources within the institution and within the community can then be mobilized to facilitate improved patient outcomes. When working in a healthcare team environment, it is crucial to have systems in place that promote the giving and receiving of timely, sensitive, and instructive feedback to members regarding performance. Ideally, all members of the team will be open to feedback from any other team member, will reflect on learning opportunities provided, and seek ways to implement improvements, all for the common goal of improving patient care.